The over 17 years Lord's Resistance Army War in northern Uganda left many individuals and families in trauma with a lot of sufferings and depression. The Kony insurgency that was characterized by torture, abduction and sexual abuse left many war survivors living in horrifying and helpless lives with infections and less access to 45-year-old resident of Okwir village, Anaka Town Council in Nwoya district, is one of such victims who live horrible lives with no access to adequate health services. He was abducted and tortured by the Lord's Resistance Army rebels in 1995. Muwaka, a parent of 5 children and a family breadwinner, is now suffering from severe keloids sustained due to injuries of torture by the Kony rebels. He was abandoned by his wife, who divorced him as his health conditions kept worsening. Muwaka is not alone. There are several community members in Lango, West Nile and Teso sub-regions that are suffering silently. But regardless of all this, the Uganda government has not done enough to come up with serious interventions to address the sufferings of several communities that were affected. The Lira Hospital principal anaesthetic officer, Dr. Okello Alex, says most of the patients need specialized medication that is not always readily available in most government facilities, and this calls for partnership with other development partners.
If you look government price, the supply gets finished in the middle. All these sort of drugs, all of them, like now, that in this case, that we are having the type of operation, we are having what is called local, where they use lignocaine, infiltrate and cut. Then another one is called regional anesthesia, where we give through the spine and block half of the body. That one is also costly. And then the one for general. All of them, in each supply, a period of 2 months. Sometimes it is supplied by 1.5 months. It's not finished. Then the other period waiting for the supply, then we either have to buy, or person have to buy, or we refer patients just because of no drugs.
It's upon this background that Health Rights International organized surgical camps at Lira and Anaka hospitals to provide integrated psychosocial supported surgical operations to the victims of the war.
At community level, that are still living with the very critical effects, physical effects of the LRA war. As a project, we are looking to support this year alone to support over 3,000 people to receive physical rehabilitation and, of course, psychosocial social support. This current camp alone running in Lira, we expect to get over 250 people. So far, the few days covered, we have over close to 50 or more who already got the surgeries, and we expect that by close of the coming week, we should have hit the targets. At least over 200 people will have gone back home happy, and their health would have been supported to get back to normal. Of course, much appreciation goes to the healthcare workers who have devoted their time to attend to overwhelming numbers of the patients, clients coming from different parts of the greater Lango region. Because the same Surgical procedures are going on right now in the Acholi sub-region alone at Anaka Hospital. That is taking care of patients from Greater Gulu and Acholi because the cases are much more actually in Acholi sub-region. So we hope to do this and more because we actually have more numbers than we need and the ability to do. But we hope that together with other stakeholders we are able to still find more resources to be able to reach out to significantly the numbers.
A Health Rights International team mobilizes and screens the war survivors with complications for physical and psychosocial rehabilitation.
Medical camp here, I'm the first contact person, receiving the patients, recording them, and sorting them to ensure that they qualify for this surgical camp as per Health Rights recommendations.
Specific project, we are providing care, specifically medical and surgical rehabilitation for the victims of the LRA war in northern Uganda. But in addition to that, we also provide mental health care services. So the project is called Integrated Physical and Psychological Rehabilitation of the War Victims in northern Uganda.
At the surgical camps, a Health Rights International team ensures that the patients adhere to the Ministry of Health guidelines on the COVID-19 standard operating procedures.
So we want to inform you that we have the sanitizers around. We have the washing can around. Wash your hands. Put on your mask at all times. Make sure you don't move these chairs from the way we have put them. Such that we are able to maintain the social distance required.
The pleasure being forwarded by these clients is to the joy of my heart. Why am I saying so? Because the service being delivered to these clients by the doctors in Lira Regional Hospital was successfully done, and most of the clients or patients are very happy because the service delivered to them has met their expectation.
And I'm working with Health Rights to help them translate and mostly know what these people are going through and tell them what they are going through.
My duty here is to make sure that the patients who are brought are welcomed, are shown where to sit. I am also standing in for their welfare and also for the staff to make sure everyone here lives when they're happy.
Dr. Andrew Odur, a gynecologist at Lira Referral Hospital, says several women who suffered sexual abuse, including rape and defilement, developed serious health complications that they have been living with all the years due to economic depression.
But through this support, we have been able to repair their perineum, and we have restored the function of those very important organs. We also had a lot of women with uteruses, the womb coming out because of multiple deliveries, because of the condition of the war that has impacted on their family life.
He says many of the women war survivors have suffered from infections including HIV/AIDS, STDs, and fistula, resulting into increased gender violence in the region.
Many families separating because of this, because it affects their sexual life, and also the women eventually fear anything to do with the reproduction in the future. These are some of the cases that we have been able to work on, and what we have been able to do is restore or repair these fistulae and strengthen the perineum, and the sphincters are restored, and we hope they'll be able to be continent of urine and also continent of the fecal matter.